Hello and welcome. I'm your host, Neil Howard. Thank you for joining us here on Health Professional Radio. In this segment, we're going to have a conversation with Amanda Rees. She's joining us here as CEO and co-founder of Bold. Now, Bold is a digital health company that provides clinical exercise programs to prevent falls, manage arthritis, and improve functional fitness in older adults. A recent study published in the Journal of Medical Internet Research shows that users of Bold's fall prevention program demonstrates a 46% decrease in annualized falls per year. Welcome to Health Professional Radio. Amanda Rees, thank you so much for joining us.
Hi, Neil. Thanks so much for having me.
I mentioned that you are a CEO and co-founder of Bold. What's your area of expertise and how did you come to be co-founder of Bold?
Absolutely. I ended up transitioning my career into healthcare after being a caregiver to a family member for 8 years. And that family member was my grandmother, who's older, and I was living with her. And after sort of being firsthand, seeing how aging was impacting her life, transitioning to care for her dementia, her falls, her hospice, her in-home care, I honestly just felt a calling to transition into working in healthcare, and particularly working in prevention. And so my partner and I founded Bold as a company because we came upon a vast amount of science and research around physical activity and how that impacts someone's health span and how they're aging. Falls in particular are an area that's very well understood, very well documented, and yet there's a gap between what we know and actually putting that into action, making it easy for more older adults to get evidence-based fall prevention programming. And so we are really focused on making that digitally accessible and doing that in partnership with health plans and healthcare organizations.
I understand that about 1 in 3 people age 65 and older, they fall each year, 1 in 3, and that the cost of these falls totals more than all the cancer care costs combined. That's astonishing to me. Is that the case?
Yes, absolutely. I often think falls are one of our top hidden costs because falling is something that we can evaluate, we can see, we can understand, but it's not a chronic condition the way that arthritis or COPD or diabetes is. And so when you think of older adults, and unfortunately, vast majority of older adults in the U.S. have 2 or more chronic conditions, all of those actually contribute to being a fall risk factor. And so I think, everybody's 1 degree or has experienced a fall themselves. What we like to focus on is, how can we use the power of balance and strength training and personalize that for an older adult to actually prevent those falls and reduce those costs. And that's really what we have built our platform to do.
There are so many reasons and causes for a fall. Maybe their eyesight caused them to think that countertop was closer than it actually was. Or maybe it's a muscle thing or arthritis thing.
Arthritis.
How can you begin to prevent falls when falls seem to be par for the course after a certain age?
So I think one of the biggest misconceptions is that falling is totally natural. I think you raised some great points. I think you can definitely do medication checks. You can do eye checks. You can recommend supportive devices like a walker, a cane, which, various individuals might be more or less open to adopting. But what's amazing about the human body is you can improve strength and balance at any age. And rather than just accept that everyone will have a fall, and falls are the leading cause of hip fractures. So, there's a lot of concerning association between falls, hip fractures, and mortality. Saying if I'm able to improve my strength and balance, particularly lower body strength, then I both decrease the likelihood that I'm falling, which can then prevent falls, and it reduces the injurious falls. So you might fall, but you might be, if you're training your reflexes, if you're training your proprioception, your balance, you might be more likely to catch yourself. And generally, it's a pretty simple but powerful indicator for how well someone is aging, is how their balance is.
Bold has developed a fall prevention program analyzing why these falls are happening. Talk about this fall prevention program and the benefits of it.
Absolutely. So our fall prevention program is administered entirely virtually online. It doesn't require downloading an app, but someone visits our website on their phone, their tablet, their computer, and they start with a personalization quiz. And that quiz is evaluating their fall history. So have they had an injurious fall, their fear of falling, which can be an indicator for increased fall risk, as well as their activity at baseline. So have they been active? What kind of activity? So their preferences. Do they prefer seated or standing? If they haven't been active, asking someone to start doing a 60-minute exercise program might be quite a leap. And so one of the things we do in our personalization process is we take these evidence-based exercises and we package it into maybe a 15-minute seated class or program. Mm-hmm. We take all those personalization questions and we actually design a custom program for that individual at a starting point that really meets them where they are. And then over a series of 12 weeks and a few classes a week, we begin increasing the challenge of the exercises. We increase the length of those classes. And over time, we have demonstrated, and we've published this research, a reduction of 46% in annualized falls per year. And so that is consistent with, like I've said, a very well understood body of research around this area. And what I'll also call out is we doubled the amount of activity, of physical exercise that these individuals are receiving. Mm-hmm. And so oftentimes when we think about exercise as someone ages, I think there's a lot of barriers around feeling like I might not be able to drive to the gym, or I haven't exercised in a long time and I'm maybe feeling self-conscious. And so by making Bold product available online and by partnering with, Medicare Advantage plans, where we are available at no cost through a lot of United Healthcare Medicare Advantage plans, we can really increase the access, make it as easy as possible for older adults, for patients to access these programs and do it in a way that really feels unique to them. And that ends up driving engagement and helping them become more active overall.
So this program addresses, not only exercise, but cognitive, mental, and emotional well-being too.
Absolutely. I mean, if you can support someone in moving more, there's so much evidence around improved heart health, improved mood and mental wellness, cognitive function as well. And so we build all of that in. We've expanded beyond falls, and we have osteoarthritis programming for knee and hip. And there we're actually really focused on pain management through exercises that are safe, effective, and take into account that individuals might have osteoarthritis. And our team of kinesiologists and trainers and researchers designed these programs to be consistent with best practices in research, which I think is unique because if you walk into, a local studio, you might get lucky and have a trainer who's very knowledgeable. You also might walk in and find an instructor who doesn't know how to make those modifications. And so by doing it virtually, whether someone's rural or, down the street from a place that offers it, it's the same program that someone's receiving, same quality.
Is there anything that you'd like to add? And then give us a website or two, if you have a couple, that our listeners can learn more about Bold.
Absolutely. So you can read more about the fall prevention work that we've done, and you can also refer patients, family, friends, anyone who might be interested. It's very easy to find us. Our website is www.agebold.com. And I think, for providers who are listening, if you have individuals on health plans, I would encourage them to check out and see if Bold is included, because as of today, there's more than 10 million older adults that have access to Bold through their health insurance. And so it's no additional cost to them. It's just an awesome benefit that they can use to improve their balance and feel like they're aging a little more boldly.
Amanda, been a pleasure speaking with you. Thank you so much for your time this morning.
Thanks, Neil. It's been great.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Amanda Rees, CEO and co-founder of Bold. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.